Hello, I'm Sonia Lockett and I'm the service lead for cardiac rehabilitation at the University Hospital of North Midlands NHS Trust. And this project was to harness the power of cardiac rehabilitation as an interim screening service in atrial fibrillation management. I can declare there are no conflicts of interest. So here's an overview of our service. We are a multidisciplinary team, that is 3 administrative staff and 15 clinicians, made up of therapists, nurses, exercise physiologists and exercise practitioners. We also have support from a cardiac pharmacist and consultant lead as necessary. And we have excellent links to our community organisations, including those in the charitable and voluntary sectors. This helps us to meet a wide range of patient needs. We are located across 14 venues in the region, that is hospitals, primary care centres and leisure centres. This combined hospital and community-based approach has helped to improve the accessibility of our service for patients. We are essentially an exercise and education intervention, so looking at lifestyle and risk factor management, such as promoting physical activity, healthy eating and smoking cessation. We also look at medical risk factor management, ensuring adherence with medications, and we assess and support for psychological health and well-being. We aim to promote patient self-management by discharging patients into long-term exit strategies. Unfortunately, we know that atrial fibrillation is not yet a priority group on our UK cardiac rehabilitation guidance, but many of these patients can have palpitations, dizziness, shortness of breath and fatigue, and they can all benefit from coming through our programme. Some benefits might include improved self-efficacy, better symptom management, identification and recognition of triggers, better overall heart rate control, increased exercise capacity, and better quality of life scores. So we were keen to support these patients into our programme. So our original pathway for these patients into our service looked like this. The patient would present with atrial fibrillation and they would have a referral into our arrhythmia specialist team. They would then have an outpatient review with either an arrhythmia nurse or consultant, and if deemed appropriate, they would be referred into cardiac rehabilitation. We would then triage that patient and provide a clinical assessment, and the patients would then be offered our comprehensive cardiac rehabilitation programme, including exercise and education. We know with this approach that referral numbers were low, they often had an exercise bias, and that for those patients triaged as non-urgent at the start of that pathway, they could be waiting 4 to 5 months for their outpatient review. So we felt we could better support these patients. And our new pathway now looks like this. The patient presents with atrial fibrillation and they are referred into the arrhythmia specialist team. At the same time, a referral is now made to our cardiac rehabilitation programme. We will triage that patient within 1 to 2 days, and we will start our education component immediately. We have now added in an extra step of screening for associated conditions and referring on when necessary. This all happens prior to specialist review. Once the patient has had that specialist clinic, they will update the original cardiac rehabilitation referral. And we will then provide a clinical assessment, usually within 14 days, and the patient will then be offered our exercise component. And we now see over 400 atrial fibrillation patients in our service annually. So what that looks like in practice. Prior to specialist review, the patients will now receive information packs. That contains information about their condition, their medications, and other lifestyle factors. The patient will also receive screening questionnaires covering things like falls risk, quality of life, and importantly for our AF population, obstructive sleep apnea. The patients are also invited to our heart support and education groups, which are supported by our consultants and specialist nurses. And the patients can also access a wide range of material on our Trust website and online patient library. Patients are encouraged to join a range of Facebook pages, including our public cardiac rehabilitation Facebook page and a special AF online community group. These pages are all monitored by our clinicians. The patient finally has access to our YouTube channel where they can access a range of audio podcasts, all delivered by various specialists in cardiology. And by using this approach, we know that we now have an additional 9% of atrial fibrillation patients identified and suspected of obstructive sleep apnea by cardiac rehabilitation with onward referral to sleep and ventilation services by ourselves. 97% of our atrial fibrillation patients rate the information packs as useful to very useful in an audit last year. And our Facebook groups are well used, with our AF support community group having over 640 followers and our UH&M cardiac rehabilitation page having over 1,000 to date. Patients report that they find our contact information very reassuring, that our sessions are enjoyable and informative, and they find this support very helpful, particularly prior to specialist review. Overall, they feel very well supported by our service. So once the patient has had that specialist review and the referral into cardiac rehabilitation has been updated, highlighting that the patient is now eligible for the exercise programme, we will provide a clinic assessment. This could be face-to-face, over the telephone, or via video link, depending upon patient preference and need. You are now going to see a series of charts where the blue bar will indicate our atrial fibrillation referrals. On the first chart there, you can see that cardiac rehabilitation clinic attendance last year was 100% for our atrial fibrillation group. The orange bar indicates our other heart conditions, which were slightly lower. At the clinic, the patients are offered an 8-week structured exercise programme. This could be gym, class, or water-based. And the charts there highlight that the uptake into those exercise programmes. So for atrial fibrillation referrals, 57% of patients choose this option. That is lower than for our other heart conditions, but it is higher than national uptake into cardiac rehabilitation programmes that sits at 50%. And of those patients that choose to take on the structured exercise programme, 97% of our atrial fibrillation patients will go on to complete the programme. So adherence and motivation appears high in that group. For patients who do not choose the structured exercise option, we're still supporting those patients with phone and home programmes as needed. And we hear from our arrhythmia specialist teams that the nature of their clinics has changed as a result of the changes to our pathway. So they now feel that they have a very well-informed patient, that their clinics can have a much more targeted approach, where they can focus on medication and interventional considerations, as a lot of the early diagnosis and lifestyle information has been covered by ourselves. This has increased their clinic capacity and improved their waiting times into appointments. We also see on our Trust patient satisfaction surveys that we receive 100% patient satisfaction in these groups, and that 100% of patients would recommend our service to family and friends. So in summary, cardiac rehabilitation services are well placed to support atrial fibrillation patients. We have a vital role to play in screening to prevent delays in onward referral and review, particularly for those associated conditions. These patients do require a flexible, menu-based approach to ensure adequate engagement, and clinic uptake and programme completion rates in this group are excellent. And this staged approach of putting education prior to specialist review and exercise post-review helps to support the wider acute cardiology pathways. We know this is a really simple solution, but it has significant patient benefits. Thank you for listening.